This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports.
Here is your special host, the Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hey everybody, Brandon here. Welcome to another episode of the Dental Up Podcast. Our guest this week is a graduate with honors from Boston University School Graduate Dentistry. He completed his dental residency at Loma Linda Veterans Hospital, learning special techniques in working with fearful patients and providing comfortable dental care. He was voted the top Chula Vista dentist for 15 consecutive years and is a well-respected speaker in the dental community. Currently practicing from San Diego, California, please welcome Dr. Sam J. Halabo, DMD. How's it going, Dr. Halabo?
It's going great. Glad to be here with you guys today.
Excellent. We really appreciate it as well. Thank you so much. I know that you're a busy man, so let's go ahead and jump right into it. Why did you get into dentistry, and at what point did you think, I want to become a dentist?
So when I was younger, I hadn't been to a dentist. My family hadn't taken me. And then when the first time they took me, it was because I had a big toothache. So I went to the dentist, in complete fear. And then the dentist took my pain away. And this guy became our family dentist. And actually, he became my mentor eventually. So right at that point, I was looking at him going, wow, this could be a pretty interesting career. This could be something pretty cool. And as I grew up, I wound up actually going to his office, volunteering there in high school as well as in college, because I liked the idea of dentistry and just the way he worked. He made his own hours. He would always talk to me about how he got to use his hands, he got to use his mind, and he was very personable, which I kind of love. I'm a dental speaker now as well as having my own dental practice. Mm-hmm. So I get to speak with a lot of people, and he was always teaching and talking. So I really, I felt very comfortable with that and thought this could be a great career. And the more I researched it and looked into it when I was in college, I was like, I think this is exactly what I want to do. So I eventually started volunteering at some different offices to see what exactly I wanted to do and really see if I was going to fall in love with it. And I did.
That's interesting that you mentioned about the fear of the dentistry and all that, or the fear of the dentist, I should say. And then I was seeing also that you had worked with dentalphobic patients at the VA, or I guess you got to apply that even further. Is that right?
Yeah, no, absolutely. So there was parts in our dental school where we actually had to work with patients in psychiatric hospitals, and that was one thing I learned right away was people who were really fearful. And then at the VA was again working with fearful patients. So that's something that's really carried on quite a bit in my career. It was also interesting, I didn't mention, when I was that young, I hadn't even spoken English yet. I didn't speak English till I was 10 years old.
Really?
So I was really terrified of the dentist. Had no idea what he was saying, what he was doing, or anything to me, which eventually becomes a career, and I become a public speaker as well later. So it's funny how life changes at times.
No doubt. And those experiences, now you get to help out others through it. That's really awesome, Doctor.
Yeah, absolutely.
So, Dr. Halabo, what was it like going to Boston University?
Oh, it was actually great. I wound up growing up in San Diego. I went to UC Santa Barbara for undergrad, and that was a great place altogether. It was, still Southern California. I got to surf, and I actually had a partial tennis scholarship, an academic scholarship. But then I decided to go to the East Coast for dental school, which I'd never been to the East Coast. Boston was also one of my favorite cities because it had the Celtics and Larry Bird playing back then. So I was a big Larry Bird fan back then. And so I decided to go there. And I also had a partial scholarship to the Boston Dental School as well. There's only a couple of those. So when you get one of those, you try to take it and run.
Yeah, you got to.
But I loved being on the East Coast at first. It was really great because I hadn't experienced all the seasons. And when we live in Southern California, we don't get too much of that. But having gone there, I experienced it, and it was great at first. But then the winters were a little tough, I got to tell you. There was a couple of winters where we had over 100 inches of snow, and it would literally, one winter I still remember, it would snow every Wednesday and every Saturday. It was nonstop. It was just, whew. So that I kind of determined that I loved the East Coast, but I was going to move back to the West Coast as soon as I had a chance.
Right. That makes perfect sense. How would you compare the seafood from West versus East?
Oh, they're both pretty good. They're a little different in their own ways, but, both of these cities that I've lived in have been on the coast, so the seafood is hard to beat in either one. So that kind of stuff is just tough. And, what's funny is I still lecture every year in Boston, so I get to go back to my roots, and I've actually lectured at my old school, too, which is really fun and interesting.
That is fun. Out of curiosity, because I see, that you've been voted the top dentist in Chula Vista for 15 years. How do you market yourself to your community?
Marketing in our community has been very interesting. Where my practice is, I'll tell you a little bit about my practice and how I kind of came back to here. I moved back to California. I went and did a 1-year residency at Loma Linda Veterans Hospital and passed my California boards and immediately started looking for offices. Once my brother one time called me and he said, "Hey, my periodontist just called. There's an office here. The guy was running. It's in the South Bay, but he had a mild stroke and he's looking for somebody to help cover for him." I said, "Well, sure. That sounds like a thing I could look into." And I had built up a number of free days at the VA because I worked all the time and I never took a day off. So I was able to go down there, and every free day I had, I would go and work and try to see how the practice was. This was a smaller practice. It was only 2.5 days a week. You only had like a day and a half of hygiene, but I thought it was kind of ideal to start, and I thought it had a lot of potential. Yeah. And this is 22 years later now. I'm in the same practice, but a much more different dynamic. We're 4 full days here, 4 days of hygiene. I have an associate on Thursdays. We have 4 or 5 people here. So to say that we've grown the practice would be an understatement. We pretty much, it's gone through a number of renovations in terms of physically and in terms of how many patients have gone through and how many we have now. It's more than quadrupled. So it's been building little by little, and marketing was definitely a big piece of it. Mm-hmm. When I started, we used to do a lot more mailers and things like that. Now it's become a lot more online with, I have a group that I work with where they do a lot of our marketing now, where I used to be able to do it a little bit more when I had more time, but now it's become something where I actually have a marketing advertising company that does most of it for us. A lot of what they do is more things like through the website, SEO, keywords with Google, some mailers still every now and then, maybe not as much as we used to. Mm-hmm. But, our practice has stayed the dynamic of it has stayed similar in that it's maintained the private practice feel the whole time, which I really love and enjoy because that's the way I like practicing. Yeah. And we like to really individualize the experience for our patients and make them feel really unique. I'm in a very tough environment here where just on my block alone, there is 6 other general dentists and 3 specialists within about 100 yards of me. Wow. So we have to really, do some unique things and make the patient experience much more different in order to make ourselves stand out. So that's something that we really pride ourselves on and really work on a lot in order to individualize the experience for the patient and make ourselves unique so that we're sought after and not just a commodity, which a lot of practices are.
Yeah, no doubt. Really give them that more like the mom and pop shop kind of feel where you get that more interpersonal relationship going.
Absolutely. And then we're very technology heavily based. So we do a lot of things where they, by the time they walk out, they're like, wow, I've never had that in other offices. So that's the thing I want to give them. I don't want them to just, go into, oh, it's just another office. They did this. They tell me what's wrong. We try to, we take photos of everything. We show them every single tooth that we're going to work on and some things that we're not going to work on. We show them everything from A to Z. They come out with a full knowledge of what's happening in their mouth by the time they walk out of our office.
Excellent. So obviously you're always into the newer technologies in dentistry that are coming out there. I mean, I know about 20 years ago or so, we started to see the scanners starting to very first come onto the market or so. And I assume you're using that CADCam technology in your office also?
Oh, absolutely. I was actually, I've been using that since 2004. So I was an early adopter, and it's interesting. I had actually even used some of these machines back in my dental school. So that was something that opened my eyes to them. So we still use them a fairly good amount. I don't use them too much for my anterior work. I have, labs like Keating Dental Lab do that kind of work for me because they do a great job. But we do use them for single units in the posterior at times, and we're also scanning with them quite a bit. So we use the scanning feature quite a bit, but definitely technology, I think, really helps out a lot. I think these kind of machines will eventually make their way sort of like digital radiography did. Mm-hmm. It was slow to start, and when the prices finally came down a little bit, it became much more mainstream, and eventually about, the majority of offices wind up having it.
Yeah, it's a very truthful thing about that. When the technology first hits, it's so expensive, but then it comes down in price and the availability is out there for the majority of us.
I think it's absolutely one of those technologies that is definitely going to be in the process and going to be mainstream very soon. It's just a matter of those prices coming down.
Yeah, certainly. Is there a certain procedure that you find to be your favorite in dentistry?
There's a few. One of the reasons I think I stayed as a general dentist is so that I could do a lot of different things. My group of speakers, we kind of talk about the super general dentists, and they call me one of them, even though I tell them, hey, I don't do my molar endos ever. I usually just send those away. I grew up with a business background with my family, so one of the things I look at as an office is I look at it as a business as well. I always tell people, I love dentistry probably more than anybody. And dentistry has been fantastic. I love every part of it, but you have to look at your practice as a business.
Yeah.
And as a business, you have to run it as a business and look at numbers as well. So with that in mind, I kind of look at every procedure. We time all our procedures and we try to see what's efficient and what's not. And one of the things that I'm not fast enough as or do efficiently is like a molar endo. So those are one of the only procedures we typically send out.
Mm-hmm.
Other than that, we tend to do a lot of things in-house. I place implants, have been placing implants for about 10 years now. I actually teach placing implants to other dentists. We do things like Invisalign. We do 6-month smiles. We do all sorts of procedures, but some of my favorites are basically the implants and some of the full mouth rehab cases where you get to really change the smiles and change the outlook of a person on their life and how they see things, and all of a sudden you start seeing them smile and be happy and be able to function and chew. Yeah. So those are some of the procedures that I really, really tend to enjoy.
Oh yeah, that has to be really rewarding from somebody who walks in and they're holding their hand in front of their face when it comes to talking to hide their smile to versus walking out with, shining bright and smiling wide.
It's funny you say that. Just yesterday, we took some final pictures on a patient where we just went through a full mouth rehab. And, I asked her, I go, so what do you think? How do you feel? And she's like, oh, my God, I wish I had done this sooner. This feels so much better. It looks so great. I get compliments all the time.
Oh, that's awesome.
So that kind of thing just makes you feel better about what you do.
Oh, no doubt. That's got to be so rewarding.
Yeah, no, that's one of the best parts of this job. It's just fantastic.
That's got to be, I don't know. That's always one of the things that's really, really fascinated me about the industry too, is just really helping the quality of life of people. And then also that self-esteem factor, to where being so afraid to show their smile.
It's interesting you say that. I actually, when I was younger, I actually helped start a homeless clinic, and I was the director of the UC San Diego Homeless Clinic. So UC San Diego had this project where they wanted to treat the homeless, and they brought in dentists like me from the Dental Society, and I actually wound up donating so much of my equipment and materials that we had here because we were doing a rehab on my office to the process. And just doing work like that, like I always tell people, if you're ever bored or you want to give back a little bit, go give back to like a homeless clinic or something like that, where you will be amazed at how appreciative these patients are. They're just so happy sometimes to get out of pain or to be able to have a few teeth to be able to function and eat with. That is like one of the best things ever. And you will get so much joy out of that, even though you're not getting compensation, but it's just the joy that fills you with doing something else for someone else.
It just kind of makes me wonder, do you have any advice you could give toward new dentists coming into the industry or starting their own practices?
Yeah, no, absolutely. And I always give this to my lectures too, because I always have a lot of the younger dentists come up during breaks and ask me questions. And so I always tell them, I go, I think every dentist coming out of dental school should either do some sort of a residency or go to work for someone who can mentor them. I know nowadays a lot of them come out and a lot of the DSOs are jumping on graduates because the graduates are coming out with so much debt and they want to get a job and start paying off some of their debt quickly.
Yeah.
But if you can really find somebody who is able to mentor you and kind of walk you through a lot of situations and teach you a lot, that is so amazingly valuable. I had to do it through a residency, but I've had others where I've had other associates where I teach them step by step and really help them grow and show them. I think that's one of the greatest things that'll teach people, help them mentor. Because when I get somebody in, I don't just teach them the dentistry. I teach them the business part. I'm teaching them marketing. I'm teaching them so many things that aren't really taught in dental schools, which even when you go to a residency program, you're not taught those things. You're just taught how to work on teeth. Well, the whole dental curriculum and the whole dental process and the dental practice is way more than just teeth. You have to be able to work with people. You have to be able to work as a business. You have to be able to do many different things and wear many hats. So if you're able to, and you're coming out of school, to find a mentor who can kind of help you through these and really work with them and learn, that's a great thing. If not, at the very least, do a residency where you get more experience and you learn a lot. Hopefully those are a couple of things that'll help out the new dentists as they come out with their big debt that they're coming out of dental schools with now.
Yeah, I would only imagine so. And do you have Oh, sorry. Go ahead.
No, go ahead. I was listening to you.
I was just kind of curious. You mentioned about speaking and meeting at dental groups. Do you have any conventions or any things coming up here soon that you're going to be attending?
Oh gosh, my next 3 months are pretty full. Probably 3 out of every 4 weekends in each of the next 3 months, I will be gone speaking somewhere. Speaking at some different dental societies. I just got booked into Texas Dental Association meeting for next year and the Hawaii Association meeting for next year. But a number of them on the West Coast, and I'm speaking in Chicago at the AGD, and I'm speaking at a couple of others on the East Coast as well. But it's going to be a pretty busy time. But I love going to conventions and kind of looking at, even whether I'm speaking or not, just looking at all the new technology and playing with a lot of the new toys that come out, because it really kind of lets you see how fast our industry is moving and where it's going in terms of our technological uses of all the items we have in dentistry.
Yeah. Did you happen to attend the ADA in San Francisco?
I actually didn't this time. This was the first one I've missed in a while, just because I actually had a lecture that weekend as well. So it was like,
you can't make it to all
and
of them.
my lecture had been booked like a year and a half in advance sometimes. So it's kind of like, So yeah, unfortunately I missed it this time. But I was at the CDA South earlier this year, and I was lecturing at that and got to spend some good time at that one as well. And I will probably be attending the Greater New York, so I probably will be there too.
Yeah, Greater New York show is always one of the best ones to go to, I'd have to say.
Yeah, definitely.
Are you going to be speaking there as well, or just attending?
Not this year. I'm attending this year, but I think I'm speaking next year.
When is there any particular subject that you tend to talk about when you do lecture, or is it pretty?
So I have a couple of different topics. One of them, I do speak on implants. I speak on the technology with implants a lot. I speak on cone beam use. We use Prexion, which is a really easy system to use for cone beam and CBCT. So I tend to talk about that. I also will talk about restorative, and I have lectures on dental materials and CADCam dentistry. So I do have a few different topics that I talk about, and all of them come from the idea from a private dentist practicing. So I'm not, I'm kind of in the trenches with most of these dentists. So my audience tends to find that really useful, and that, I talk about everyday things that we do with these different procedures and processes in the office. And, I talk about the business sense in every one of the lectures as well, because I think that's important as well. So kind of try to make it a full round out course so that people can really take lots of little gems back to their practices and use them.
Out of curiosity, how did you happen to become the editor of Inside Dentistry?
So when you write a lot of articles and go through a lot of things, eventually they start going, okay, we'd like for you to kind of start evaluating some of the articles we get here. Mm-hmm. And I've written numerous articles here, and I write, a few every year. So eventually I was asked, hey, would you like to be an editor? And so as an editor, you get to look at a lot of these articles, and you can make corrections or give advice to some of the article writers and things like that. So that's a pretty fun thing. So I get to have time for that. And I evaluate products as well for a couple of different groups, including the Catapult group and CR. So, it keeps you kind of busy. It's a lot to do, but it keeps you busy and it keeps it fun as well. Yeah,
I bet. No doubt. I mean, it's kind of interesting. I was thinking about that earlier when you had mentioned on the dental materials and then also CADCam, because that's always one of those things that especially from a lab standpoint, that we were always looking at was kind of that elimination of yet another expansion contraction. Have you noticed superior fits with CAD-CAMs or with dental scanners versus other impression materials?
Oh, absolutely. There's so many articles now illustrating this too. So it's not just our words, the people who are using it, but there is so much more accuracy in terms of CAD-CAM dentistry and the scanning ability of it. That, there's so much less remake, so much better margins and things like that. And I always tell dentists too, a lot of things you're going to see are that you're actually being able to see your finish lines, and you see them right in front of you, where a lot of times you look at them in impression, you go, it looks good enough. But there's been a lot of studies also that show how many impressions need some more work that are coming from dentists to labs. So I always like the idea of being able to see your margins right away and picking them out for the lab, because you're the one treating the patient. So it's always great for you to outline that margin for the lab. You end up getting much better results, and you get to see what your work looks like. You can make any adjustments before you actually, send that STL file to the lab. So there's a lot more that's coming with it. And that's why I keep saying I think it's eventually going to take over the future of impression making.
Yeah, I couldn't agree more. I mean, throughout the past, I don't know how many times you have that conversation where it's, you take that impression and you're looking at it, it's almost like the negative of a developed photo. And it's hard to see that clarity, but just like you're saying, when you see it right there, real time, right in front of you, and you can, wait, I need to go back and rescan that area. You have that so much more control and insurance of accuracy.
Oh, absolutely. And like I said, a lot of the studies and a lot of the articles show that now. They've done a number of comparisons, and I talk about them in my lectures too, and I show these articles just showing that the accuracy versus an impression. And it's just one of those things that's going to be coming, and sooner and later, and it's going to happen. As soon as those prices come down, then everybody gets a machine eventually, I think.
Yeah, much agreed. So I think we're pretty much wrapped up with all the questions I had. Is there anything you'd like to add?
No, I think it's great. I love the fact that you have these podcasts here that can help people understand things. If anybody ever has a question or wants anything, more than happy to email them. I'm sure you guys might list that with a podcast. And, if there are any questions or any new kids who want to ask questions about anything in general, or have questions in general about dental career and things to do, I'm more than happy to answer them. So thank you for having me today, too. It's been great.
Oh, yeah. I really appreciate you, Dr. Halabo. It's been, quite honestly, rather educational and fun conversation. Thank you so much for being on the podcast.
Good. Thank you, guys. Thank you for doing such a great job.
Thank you very much, Dr. Halabo. I hope you have a great afternoon, and we'll be in touch.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.